Neurotransmitters are chemical messengers that transmit signals across synapses from one neuron to another. Imbalances in these neurotransmitters can lead to various neurological or psychological disorders. So first, let's discuss acetylcholine. So acetylcholine is a neurotransmitter that works in muscle action, learning, and memory. When there's too much acetylcholine, this could lead to muscle spasms and excessive stimulation of the brain. So imagine if it's involved in creating action with your muscle, involved with moving your muscles and learning memory. When there's too much movement of your muscles would happen then. So that would cause muscle spasms and then excessive stimulation of the brain. Undersupply, so when there's not enough acetylcholine, when there's a deficiency, it could link to Alzheimer's disease and muscle weakness. Now, dopamine is a neurotransmitter revolving around reward, motivation, and motor control. So too much of dopamine could cause schizophrenia and manic episodes in bipolar disorder, and a deficiency in dopamine could result in Parkinson's disease since it's about motor control. So imagine losing your control in your motors, Parkinson's disease, those tremors, depression, and ADHD. Serotonin. Serotonin is involved in regulating mood, appetite, sleep, and arousal. Too much of it, which is pretty rare by the way, can lead to serotonin syndrome, causing agitation, confusion, and rapid heart rate. Fun fact, serotonin syndrome can actually happen from taking in too much of those certain antidepressants. And undersupply would be causing depression, anxiety disorder, and OCD. So remember what I said a while ago about how serotonin syndrome could be because of taking too much antidepressants? So for when you're depressed, right? If someone believes that someone is depressed because of the lack of serotonin in their brain, the doctor will prescribe a drug that has a lot of serotonin. However, if the dosage is too high or if the person is not taking it as they should, if it should be 1 tablet a day, but instead they take it 5 tablets a day for some reason, that could cause too much serotonin in the body, and that would cause serotonin syndrome. Next, norepinephrine, also known as noradrenaline. Its function involves alertness, arousal, and the fight or flight response. Both the epinephrine, by the way, and the norepinephrine are related to the fight or flight response. Too much of the norepinephrine could lead to anxiety, stress, and panic attacks. So imagine being too much on your fight or flight mode. You'd be too anxious. You're too aware, you're too alert. However, an undersupply could lead to depression or attention deficits. Epinephrine, too much of it could also lead to severe stress and anxiety, hypertension, and palpitations. Undersupply would be rare, by the way, but could contribute to diminished response to stress. GABA is a neurotransmitter that is the major inhibitory neurotransmitter that reduces neuronal excitability. So too much of this GABA, too much of this inhibitory can lead to excessive sedation, muscle weakness, and respiratory depression. Undersupply would lead to anxiety disorder, epilepsy, and insomnia. Glutamate is a major excitatory neurotransmitter involved in learning and memory. So too much of this glutamate could lead to excitotoxicity, leading to neural damage and conditions like stroke and neurodegenerative diseases. A deficiency in glutamate could cause cognitive impairments and conditions like schizophrenia. We have endorphins, and endorphins are neurotransmitters that are involved in pain relief and feelings of pleasure. Too much endorphins, which is rare, can result in an inability to feel pain and potentially risky behavior due to lack of pain signaling. Now, a deficiency in endorphins would link to increased sensitivity to pain and emotional distress, such as depression. Glutamine is a neurotransmitter, a precursor to both glutamate and GABA, is involved in metabolism and neurotransmission. Too much of the glutamine can contribute to excitotoxicity and neuronal damage. Undersupply could lead to disruptions in the balance of GABA and glutamate, impacting mood and cognitive functions. Glycine is an inhibitory neurotransmitter in the spinal cord and the brainstem. Too much of glycine can cause respiratory depression and muscle rigidity. Now, a deficiency in glutamine is linked to spasticity and hyperexcitability of neurons. And lastly, histamine. It's involved in immune response, digestion, and regulation of sleep-wake cycles. Too much of histamine will cause allergic reactions, inflammation, and symptoms of anxiety. Now, a deficiency of histamine is associated with decreased alertness and excessive sleepiness.